But good afternoon. Thank you for being here, and we welcome you to the San Francisco campus of Jewish Living. My name is Amy LeGrant, and I'm the sales director for Frank Residences here on the campus. And we are very excited to have you all here and have the opportunity to share with you on a very important topic. My background is actually in gerontology. I hope many of you know what that is, but if you don't, it's the study of aging. So this topic is very near and dear to my heart for us to have a discussion about what normal aging looks like and how do you handle all of that. So I am very excited to have the opportunity to introduce our President and CEO, Dr. Adrienne Green, and have her share her experiences with you all. And then hopefully we'll be able to have a Q&A and further discussions on maybe some of your experiences. So thank you all for being here, and very excited to meet each and every one of you as we continue our afternoon together.
Well, I am so excited to see everyone here today, and I'm really happy that we have a mix here of folks who perhaps haven't ever been to our campus, and some residents who have chosen to live here. So thank you all for joining us. This is very much meant to be relatively informal. I have slides to sort of keep us on track, but please feel free to raise your hand or do a little shout out if you have a question as we move forward, and I have a few questions for you as well. I have been here now about 18 months, and we titled this presentation Normalizing Aging because one of the things that I've been thinking a lot about since I arrived here is that there are many people and there are many settings out there in which people, aging is not embraced. And I feel very strongly that we need to start to change the narrative. And that's sort of the focus of what we're going to talk about today. So what I thought I would do first, particularly for those of you who have not been here before, is to just share a little bit in terms of introduction about San Francisco Campus for Jewish Living. I will then turn, when we do some introductions, and just think about what brought us all here today, what was interesting about this topic. I will share with you a little bit about my grandmother. That's Lillian's story, because a lot of the way that I approach this comes from my experience with my grandmother. Then we'll just talk about some facts about normal aging as a way of sort of centering ourselves around this topic, and then hopefully have a little bit of time for some discussion at the end. So the San Francisco Campus for Jewish Living is the umbrella under which sits the Jewish Home and Rehabilitation Center. That is our 375-bed skilled nursing facility, which is largely on that side of our campus. We have both long-term care, short-term post-acute rehab for folks who have been in the hospital, say have had a surgery or a pneumonia and need some rehabilitation before going home. And then we have a 12-bed acute geriatric psychiatry unit for folks who are over the age of 55 and have had an acute mental health issue. And then we have the Frank Residences. That's where we're sitting right now. The Frank Residences is a 190-unit assisted living and memory care. 113 of the units are assisted living. The other 77 are memory care units organized into neighborhoods. And then part of the Frank Residences is something that we call Buyer Square. And Buyer Square is part of what you're sitting right now. These are the amenities and the programs that we have here for our residents, and sort of increasingly for programs like this for the community as well. Very quickly, I'll just run through our vision, our mission, and our values. Our vision is to fully embrace aging in a community that is deeply rooted in Jewish values. Our mission is to provide older adults with comprehensive and innovative care that fosters purpose, dignity, and joy. And our values are compassion, community, and excellence. We really pride ourselves on the high quality care that we provide here. And I think that for those of you who live here, I hope you already feel this. And for those of you who are new to our campus, I hope that you'll see that we really live our values every day, and we're working incredibly hard to achieve our ambitious vision. So before we get too far into things, I thought I would quickly introduce myself and why I am here today, and then I'm hoping that a few of you will introduce yourselves and tell us why you decided to join us here today. So I wasn't born in Portland, Oregon. I was born in Alaska. That's a fun fact about me that most people don't know because my dad was in the Air Force. But I grew up in Portland, Oregon. That sort of picture and view of Mount Hood absolutely never gets old. I think that's where I sort of adopted my love of mountains and waterfalls and being outside in nature. And then I bounced around the country to college and medical school, and then decided that I really am not an East Coast kind of girl, and came back to the West Coast for my residency in internal medicine, which I did a little bit south of here, down at Stanford. And then about 27 years ago now, I joined the faculty at UCSF as a hospitalist, as a general internist who spends their time in the hospital. Very quickly became involved in a lot of administrative and leadership activities, was the chief medical officer there for a number of years. And then 18 months ago, I had the amazing opportunity to sort of combine my experience, my expertise, and some of the things that I'm most passionate about, and come over here as the CEO. And some of the things that sort of tie all of that together are that I am very interested in healthcare systems, and particularly in making sure that our healthcare systems are organized in ways that best serve the needs of the population. I feel I've always had an affinity for geriatrics and palliative care, and I have spent a lot of time thinking about post-acute care in that sort of hospital to home and hospital to skilled nursing transition, which is sort of a natural fit with what we do here. And through all of that, I think some of the values that I hold very dear are around sort of compassion and excellence. I feel very strongly about quality of care and safety of care, and making sure that we sort of have an equitable care system for everyone. So I mentioned that I was going to talk a little bit about my grandmother, because I think her experience has very much shaped the way I think about both the sort of the medical care and approach to living situations for folks as they get older. So I'd like to introduce my grandmother. This is Lillian. She was born in Poland. She moved to Toronto when she was 4. She met my grandfather in New York when she was 16 and got married. There's a long story there. And then they eventually moved out here to San Francisco, and they spent most of their adult lives in San Francisco. She had 3 boys. My dad was her middle son, and 5 grandchildren. And she was a very social, life of the party, always wanted to have people around her kind of person. And this is a photo from my grandparents' 50th wedding anniversary. You can tell by all of our attire that this was in the 70s. You can just see how happy she is to have people around her. There were, over 50 people there, and she was just, that was where she thrived. She volunteered at the Jewish Museum in San Francisco and many other organizations well into her 80s. She was, still entertaining. And then a couple of things started to happen. She developed hearing loss and didn't really want to admit that she was losing her hearing. And then when she was able to sort of acknowledge that she was losing her hearing, I think like many, many people, she felt this stigma around hearing aids. If I have a hearing aid, then I'm old. And, I can't be seen with, a hearing aid. She developed some vision loss and had very poor follow-up with her eye doctors. Despite having both a son and a granddaughter, who were doctors, and another son who was a pharmacist. She hated going to the doctor, and so she had very poor follow-up. So between her hearing and her vision, both declining, all of the many of the sensory inputs that people need for daily function were gone. And that caused her to sort of withdraw, and it caused communication issues. I think people assumed that because of that, her cognition or her thinking wasn't as good as it was previously, even though it was likely due to the vision and the hearing loss. And then she had a fall and she injured her back. That caused some decreased mobility. And for all the reasons I've already mentioned, she wasn't super compliant with the physical therapy, and she very much did not want to use a cane or a walker for all the same reasons as the hearing aid. And as some of these things were happening, my dad and his younger brother did a lot of work to see if they could convince her to move into a senior living community. They looked at a lot of different places, both in San Francisco and in Portland, and she very much wanted to stay in her own home and really put her foot down and said, I am staying in my own home no matter what. And I think we didn't have the right words to prompt the thinking that I would retrospectively use to encourage her to be in a community-based living setting. She would absolutely have thrived in this kind of a setting. She loved being around people, and unfortunately, instead, she ended up essentially bedbound and very depressed with cognitive decline because of all of these other factors. And to me, obviously, watching it was very sad to see someone who she actually lived to be 100 or 101. But the last 5 years of her life were just very withdrawn and so completely different from the person that we saw in that picture. There were quite a lot of places along this, or time points along this trajectory, where intervention would have made a huge difference. Hearing aids, better attention to her eyes, perhaps being able to work on her balance and strength, so that she, didn't lose that strength and become bedbound. And I very much think about that a lot, and I wish that somebody had been able to say to her, and that we had known to say to her, this is normal. It is normal for your hearing to decrease over time, and this is how we address it. But unfortunately, we didn't have the words that worked for her. Well, I think that one of the things that contributes to the social and societal stigmas around aging is the fact that when people hit the age of 40, they apparently feel, and this is from real data, 20% younger than their actual age. So, apparently I feel 48, my 85-year-old father feels 68. No wonder, we think we're invincible, and no wonder we don't address things as if they were appropriate for our actual age. So sort of with my grandmother's story as a backdrop, one of the things I wanted to do was just provide you with some facts about normal aging. And I've chosen just sort of two common changes that occur, both hearing loss and decreased mobility and strength, as just sort of to create a talking point for all of this. And I really want to sort of use this to highlight that these changes happen to everyone. And therefore, we shouldn't be stigmatizing, we should be thinking about solutions. We should be thinking about ways to sort of optimize function and help people to compensate for the things that happen naturally with aging, rather than stigmatizing them. So first, really quickly about hearing loss. So hearing loss, I think, is probably not a big surprise to anyone, can lead to social isolation, it can lead to depression, it can lead to cognitive decline, I'm sure that folks know how much it impacts communication. You just mentioned about, your husband's hearing. And I think that can lead to frustration between family members, with caregivers, there are impacts of not sort of acknowledging and addressing one's hearing loss. In terms of numbers, hearing loss affects 40% of those in their 70s and 80% of people over 85. And this is not from esoteric causes of hearing loss. This is just from sort of the natural process of aging. On the other hand, hearing aids have been shown to improve social and cognitive outcomes. Unfortunately, 67 to 86% of those folks who could benefit from hearing aids aren't using them. And I think this is one of those things that we need to sort of start, turning the tide around. Places like Costco have figured this out. They've now got a huge business around hearing aids because of all of the challenges that people have had related to cost and insurance and whatnot. And I think this is just a really, really important point that hearing is something that's easy to address in the big scheme of things. Okay, well, the other thing that I wanted to highlight was mobility, because I think that's something else that's very, very common. And I think there are, again, these stigmas around walkers and canes. And, one of the things that really brought this to light to me was actually a friend of my dad's who lives in an independent living community where there's a dining room. His friend actually said that she wouldn't go to the dining room because that's where people with walkers and canes were, and she didn't want to feel old. And I just, like, that comment absolutely made me cringe. She knows where I work and what I do, and it's so ageist. And that is coming from someone in her 80s. So it's just like these stigmas and perceptions are so inbred. And again, this is where I'm really hoping that we can start changing the narrative around some of this. A few facts about mobility. 80% of people over the age of 85 struggle with mobility. 40% of those over 85 use some sort of mobility aid, like a cane, a walker, or a wheelchair. And then a lot of people, unfortunately, because of this, fall each year. 25% of those over the age of 65 and 50% over the age of 80. And I think, unfortunately, with falls, they create a little bit of a vicious cycle where people fall and then they develop this fear of falling, and so they get very, very cautious, so they don't move around as much. That leads to weakness, and that leads to more falls. And so figuring out ways to stop that cycle are really, really important. There are ways, though, to help with balance, to help with gait, and to prevent falls. And those include some things that are relatively simple. Strength and balance training, which I know those of you who do live here have great access to over in the fitness center with a lot of our classes. Interestingly, Tai Chi has gotten a lot of press around its efficacy in terms of improving balance and preventing falls. It works better than the strength and balance training. It's really important to address one's vision. So not just thinking about your strength or your muscles or your joints. Other inputs actually impact falls. So making sure you address vision is really, really important. For those who are living at home and in apartments, it's really important to look at safety hazards. There are a lot of ways to do this, but throw rugs are probably like the worst thing in the world. Many, many, many falls every year because people are just like, I love that rug. I can't roll it up and put it away, and then there's a fall. And then working with your physician or primary care team to go through your medications, because there are some medications that can contribute to increased risk of falling. And sometimes those can just be altered a little bit to help. So I think those same ageist stigmas that apply to things like hearing aids and to walkers, as we've talked about already, also apply to senior living and assisted living. And there's a whole bunch of comments that I'm sure many of you have heard that probably make all of us cringe. But that's where all the old people live, and I don't want to be reminded that I'm old. I don't need that yet. And then I think another one is, I just can't leave my home. I've lived here over 50 years, and it's like a warm blanket around me. And I think for people to realize that they can recreate some of that safety and some of that blanket in an environment like this it's hard to do, but it can be done. And I think that's something that we really need to be able to help people to understand. And then lastly, data really supports that senior living actually improves outcomes. It improves quality of life, it improves function, and it improves health outcomes. And I think a lot of that is due to the care that's provided, but that's also sort of balanced by the improvement that one gains by being in a community. I think the community is as important as the care assistance that people are able to get in an environment like this one. And I think just really, really important to know that people thrive in this kind of environment at the right time. And I think that gets to some of the things that you were all sort of bringing up earlier, is sort of, what are the questions that we should be asking and trying to sort of sort through in order to decide, what is the right timing and what are the best options for either getting extra help at home or moving into an environment like this. And so I think some of the things that I would suggest that folks ask themselves, or I think these questions can equally well be asked by sort of adult children, in terms of the asking them in the form of like, can my mom or dad do this? But really thinking about, what is most important to me as I grow older, and have I discussed this with my loved ones? I am a huge advocate of over communication about almost everything in this domain, particularly related to advanced care planning and what your wishes are. But really thinking through what's most important to you is probably the core of all of this. And then the next thing I think is just really thinking through, am I safe in my current living environment? And what would happen if I fell? What would happen if I fell and wasn't able to get up? Are there things that are important to me that I'm not able to do any longer because of the impact of normal aging? And then what are some of these strategies, as we've talked about for a few of these things, that can be implemented with the help of my family, with the help of caregivers, with the help of physician teams or case managers, in order to compensate for some of those factors. And then really just thinking through the pros and cons of your current living environment and what a different setting would mean. And then I think lastly, I hear this a lot, but to ask yourself, am I waiting for the next blank before feeling like I'm ready to make plans? Like, am I waiting for the next fall? Am I waiting for the next stroke? Am I waiting for the next whatever? Because I think if you're already thinking that, it's probably time. And not waiting for the next one is probably really sage advice. So last question is, when should I be looking for more support or community living as an option? Sort of really pulling all of these things together. And to help answer that question, I would like to invite Amy back up. And then when she's done, we can have a little bit of discussion if folks want.
Hi, everybody. So this, Dr. Green brought this question to me, and she asked me if I'd take a moment and have an opportunity to share that. And one thing, I've been working in senior living for many decades, and one of the things that always is said when people move into a senior living community, and I think some of the residents here may agree with this statement, is I should have done this sooner. And that everybody always feels like they waited just a little bit too long to make the decision because of all the fears and all of the misconceptions they thought living in a community was going to be like. And it turned out actually was very different. And so one of the things that we also know, and I think somebody made a comment about how they thought their mom was going to only be living there for 2 years and ended up living there for 15 years, I think it was. And it actually has changed over the years. And actually the average length in a community is going up higher into the 10-year range. And that we are seeing the effects of living in a community environment is actually changing the trajectory of people's lives, and that people are living, who live in senior living communities and make the choice of community living, are actually living healthier, better lives than their counterparts that decided to, what's that term? Age in place and stay in their homes. And so to make a concerted effort to war against normal aging, I always call senior living the antidote, that it's the potion that we can take in order to help us stay healthier, happier, longer. Human connection and our ability to connect in a senior living community, those opportunities are exponentially higher. And so that allows us to be able to have this more normal, healthy aging. And so my question, I think all of the questions that we just outlined are very important questions of when should I start looking? Personally, in my background, I think we all should be looking at those as an option when we start to feel like we are stepping away from things that we love to do because we are either contained by our environment. I actually had an opportunity to talk to the National Association of Home Builders. And one of the things that they look to gerontologists for is to actually help them figure out what homes should be like. But our industry of home builders, I will unfortunately, sorry for any home builders that are in the room, but they're not built for aging. They are not, the way that they're built is based on economics, not on are these environments that will create safe places to age in place. And so a lot of the homes that all of us live in or have lived in are probably not the most conducive for healthy aging. And so I say for anybody, come talk to professionals that are in this space and senior living to just start to learn about what these community environments are. And if you're thinking about doing it, my recommendation is do it, because if you do make the decision and when you make the decision, you'll think you did it 2 or 3 years later. And one of the other things is I've talked to a lot of families over the years that did wait too long. One thing you always have to consider is you also have in a senior living community, and especially in assisted living or memory care, or if you're looking at independent living, you want to be healthy when you make this change. You don't want to be making this change, as they were talking about, after the next fall or after the next stroke or whatever that may be. And none of us have our crystal ball, so we don't know when that's going to happen. It could be 5 years from now, it could be tomorrow. And so when you're healthy and you're able to actively make this decision and actively make the move is when you should make the move. Because you don't want to be in a situation where your family has to make that move for you or make that decision for you, or you don't want to be in a situation where you don't have that autonomy. And so my recommendation is do it now. and do it while you're healthy and while you can make that decision. And always educate yourself around what is available to you, because if I always make a joke about, if you've been to one senior living community, you've been to one senior living community. There are so many different options. We have a very beautiful, competitive community here with Frank Residences that is a great option for anybody here in the Bay Area.